For my PICO project, I presented on CPM machine use for post-operative ACL patients in order to increase range of motion. There are many advantages and disadvantages to using a CPM machine, which is why there's still debate on whether or not it is actually beneficial. Before I get into advantages and disadvantages, I am going to demonstrate how to use a CPM machine. Well, before you even start it, you have to strap the patient in. One strap here and the other around their foot, and adjust it so that it's the right length for their leg. Once that's set, you can adjust the settings on the remote. This button here is for the extension angle, which I have set to 0. This button here is for flexion angle, which I have set to 100 degrees. This increases it, this decreases it. This button is for the speed that the CPM moves at. This is for, you can have a setting so that it can stop and hold at a certain angle. For example, you can have it set so that it stops for 10 seconds at 90 degrees of flexion or 0 degrees of extension. And this button starts and stops it, and then this one reverses flexion. Thank you. This is just a demonstration of the movement of a CPM machine. You can set it to go faster or slower, depending on the phase your patient is in for healing. Preferably have it Velcroed.
You already have that? Yeah.
Alright. And now it's going back down into extension. Okay, so usually the CPM goes 3 phases through the full flexion and extension range of motion that you have it preset at. And then you can always give your patient the remote so they can change the settings or stop it or start it if it feels uncomfortable for them. So a few advantages of the CPM machine is that it can prevent joint stiffness and maintain motion after surgery. Stiffness usually happens due to long periods of immobilization. So early light mobilization may decrease stiffness right away. And this is especially good for the knee because the knee is prone to stiffness if it's immobilized or after surgery. Early passive motion also has a pumping effect, which can help to reduce any excess edema that may be pooling in the joint, which usually does happen after surgery. This early passive motion is a nice baby step towards active or weight-bearing motion. Like I said earlier, after surgery or long periods of increase in stiffness along with a decrease in edema does increase range of motion. And quicker gains in range of motion does get the patient out of the hospital quicker. So a CPM machine used after any type of surgery may decrease a hospital stay, and therefore it can save the patient money. Early immobilization also prevents any excess scar tissue that may build up in the joint. There are also a few disadvantages to this machine. There are suggestions that it may be too aggressive of a treatment because of the fact that it uses motion in the inflammatory phase of an injury, and during the inflammatory phase, the injured area needs rest in order to heal. So it can be deemed aggressive, but some people actually disagree with that. There are also studies that say that the CPM machine has a decrease in motion and actually less pumping effect than is expected out of it, so that the benefits are actually not as beneficial as one would think they would be. And some people also say that the CPM machine takes a lot of time, but it actually takes about the same amount of time as a rehab session would. The patient usually goes for about an hour, maybe once or twice a day, depending on the type of surgery they had and the type of graft they had as well. And then another disadvantage is that it can be expensive, but actually the cost of a CPM machine is less than paying for physical therapy. So it can actually save a patient money if they chose CPM machine over physical therapy, and if they get out of the hospital sooner because of quicker range of motion gains due to the CPM machine. And then there are research studies that say that admit to the CPM machine having short-term benefits, but that there are no long-term benefits for its use, so that it is really pointless because it doesn't help with any long-term effects for the patient. It just gets them out of the hospital quicker. So, based on my research, I believe that using a CPM machine is a good tool, especially after surgery or any long period of immobilization, and I believe it's especially good for the knee, and that the many benefits outweigh the small list of disadvantages. I would definitely suggest using a CPM machine with any post-operative ACL patient.